okay?
Yeah.
Yeah.
Okay, great.
Sorry
I got
about
my
that.
AirPods in. No, that's
Yeah.
okay.
Like, I saw your invite and it which would not let me let you in, so
It's all good. We're in now.
yeah. But for those who are currently joining, we'll probably start in about 2 minutes or so. So just stay on and we'll start then. But really, thank you so much for joining us today, Dr. Kraft.
Oh, thank you for having me.
Yeah, no, we're so excited. I don't know too much about transplant surgery, so
Yeah.
I think it was super cool.
Well, good. Well, I'm still very early in my career, still learning myself.
No
But it's been great so far.
No problem.
Sarah, by the way, good to meet you.
Oh, good to meet you too.
But so are you currently at Vanderbilt or in Nashville right now?
Yes.
Do you live on the outskirts or are you more actually in Nashville?
No, I live pretty close to the hospital, so
Okay.
I live like a mile or two from Vanderbilt. Like I live really close to Centennial Park.
Oh, that's nice.
At home. Yeah.
That's nice. No, I'm currently in Huntsville, so we drive all the time.
Okay,
to
all the time.
Yeah,
Yeah.
all the time in Nashville.
Very close.
Yeah, so I don't know how you do it. I hate traffic so much.
I know. Well, luckily, like getting to and from work very early in the morning, there's not too much traffic. It's the leaving the hospital traffic that's really terrible. But I don't have far to go.
That's true. How do you like it there so far?
I love it. Love the faculty. The city's really great. The residents are great.
Yeah.
So highly recommend.
That's awesome. Would do it 10 out of 10.
Yeah.
Let's see. So we got 30 more seconds, but honestly, we could probably just start. So start introducing myself. I'm Amber. I'm currently a third year at LMU DCOM, and this is Sarah.
Hi, everyone. I'm Sarah Campbell. I'm a fourth year med student at MSU Com.
And we have Dr. Kraft here today, and if you would like to tell everyone about yourself,
yeah,
we would love it.
So I'm Kathryn Kraft. I am the second year abdominal transplant surgery fellow at Vanderbilt University. I'm originally from California. I grew up there, was in high school there, and then moved across the country and did undergrad at Notre Dame, and then slowly have been moving more south. I did med school at University of Kentucky, stayed at UK for residency, and now I'm in Nashville.
So you hopped around a bit.
I did. I've just slowly over the last 10 years have been going more and more south.
Yeah. Found your way here.
Yes.
I guess for the next thing we're interested in hearing about is what particularly motivated you to pursue transplant surgery?
I really fell in love with transplant surgery midway through my residency. I loved the patient population and I really loved the surgeries. They're some of like the biggest surgeries, the most dissection, very complex surgeries that I was able to do during residency, and I just loved it. And then like ever since then, during the remainder of residency, I'd be doing other cases and I'd just be thinking, oh man, I really wish I was in a liver transplant right now. So just something about that really, really caught my eye. And I think it's the complexity in our patient population. There's not that many people who are excited to come to the hospital. But transplant patients, when they get that call that there's an organ offer for them, are always really excited. And it's really very rewarding to kind of be part of that process.
That is a very cool patient population. That's something I hadn't considered before, but I'm sure they're extremely excited and grateful that you're going to give them a new organ.
Yeah.
So, I mean, since you decided kind of later on you wanted to do transplant surgery, so I'm assuming you kind of just first were general surgery route and then you're like, wherever it takes me from there, I'll go kind of deal.
I think like many in the field of medicine, you kind of change your mind a couple of times.
Right.
So even in medical school, I wasn't completely sold on surgery initially. I always had the idea of surgery in the back of my mind, but I kind of went through a couple other specialties that I felt like I had to really rule out before I fully committed to surgery. And so like initially I thought I was going to do family medicine because it had wide variety of cases, wide variety of patients. And then in actually going through medical school, you kind of realize it's very clinic based, and I wanted to do something a little bit more procedural. So then I thought, well, maybe I'll be an emergency medicine doctor, and which is very procedural, high acuity, also lots of variety, lots of patient ages. But I found that when I was rotating in the ER, my favorite part was going on the trauma resuscitations and then going with the trauma team up to the OR. And so I always had that kind of idea of surgery and love of surgery in the back of my mind. And so after I kind of ruled those things out, I was like, okay, I'm going to be a surgeon. And then again, same kind of along the same lines, I wanted to do something that had kind of a lot of variety. And so I thought I was going to be a general surgeon. And then throughout residency, I started ruling out other specialties. And then I got to transplant and really loved, again, the complexity.
Right.
You get to operate pretty much in the whole abdominal cavity, very, very medically complex patients. So you're still thinking about the whole person, the whole organ, lots of different let's see, like systems go into treating those patients. Not that that's not true for other specialties, but I just really connected with transplant surgery and then the medicine that also goes along with it.
Understood.
I have a question that's just sort of a silly question, but what is the longest surgery you've ever been in?
The longest surgery I've been in was, I don't think it was a transplant. I did a 12-hour surgery with one of the EGS faculty in residency, but it was a really big lysis of adhesions, ostomy takedown, abdominal wall reconstruction. So it's really like 3 surgeries in one. That one was definitely one of the longest. I've been in some long hepatobiliary surgery, Whipples, that were almost that long. If we're pushing more than 8 hours in a transplant, we start to get maybe not necessarily nervous, but you start trying to think of how can we keep this operation efficient? How do we get the patient out of the operating room? So luckily I have not had any 12-hour transplants yet, but the whole transplant process can be at least that long if I'm the one that's doing the donor operation and then bringing the liver back per se. That's definitely more than 12 hours, and it's all kind of in continuity of care for the same patient, but I'm not scrubbed that whole time.
So it's still a very long day. It's just the surgery doesn't necessarily take super long.
Yes. Okay, there's some breaks in there.
And so it seems like that you have to be kind of on your toes a lot. So how do you say the lifestyle is for transplant surgeons, and how do you balance that with your own hobbies or any other extracurricular / family?
Yeah, that's a great question. So you have to be very flexible. It's not like other specialties where there's a lot of shift work, or you're like you kind of have a little bit more predictable call schedule where you'll be on call, but you kind of may not expect to be called in very often. For transplant, when you're on call, and more often than not you're operating, so that kind of factors into your plans. But at the same time, when you're not on call, I mean, I'm often not at work, and even like now, if we're not doing anything during the day, go in, round, take care of what I need to do, and then come home. So it is kind of flexible like that. So you take all that into consideration and kind of balance everything out. Ultimately, it is a team sport. All the transplant groups have lots of partners to kind of help out, and so since you're always trading off call with them, I've found, at least for me, plenty of time for hobbies and family and those sorts of things. It does take a little bit of planning, but can definitely make it work.
Would you say it's kind of better hours than just a general surgeon, typically? Or just
not necessarily. It's different. Okay. Depending on the type of general surgery job that you're looking at or that you'll take, especially in places where you have a smaller group, you may be taking more call. You may not necessarily be coming in quite as often. You may not be operating at night as often, but you may be operating a little bit more often. Gotcha. For us on transplant, I'm frequently operating in the middle of the night, but again, it's like those set days on call, I can kind of expect to be operating, and then the days I'm not on call, I expect to not be operating. Gotcha. Although again, we're flexible. We've certainly had cases where myself and the attending have been operating and it got really complex, and they called a partner who wasn't on call but who was around and available. But that's the case with every surgery practice, I think. So they're just different hours.
Yeah.
We were kind of also wondering, on an unrelated note, we know that like transplant surgery as a fellowship is one of the more difficult ones to match into. So we're wondering, what does it take to match into one of these fellowship spots? And like, what did you do to personally make yourself stand out as an applicant?
So that's another great question. I think things to keep in mind, or things to think about when you're pursuing a career like this, is kind of in the same big categories as other fellowships. So research, what research experience do you have? Are you presenting at meetings, national meetings? I didn't actually have very much research when I applied, but I did have some leadership opportunities, participated in those sorts of things. So research, leadership, obviously test scores are a factor. And the transplant community is very small as well. So a lot of it is building connections and networking with more senior surgeons. So for me, I had, my mentors reached out to other people in the transplant community and kind of spoke up on my behalf and said, I have a great applicant, or, whatever. And I think they'd be a good match for you. And so that also was kind of a big role. So really working on those networking connections and building those things.
That has been a very common theme throughout this series, just having great mentors and being well connected with more senior surgeons who will just call somebody up and vouch for you, doing those sorts of things. And one of the surgeons we talked to, who was a plastic surgeon, she said that the way she went about making relationships was going to conferences. So in your opinion, what in your journey, what did you do to help build those relationships?
The biggest, I actually wasn't able to go to too many conferences as a resident, but I did build those relationships with the faculty in my residency program. So part of that is just doing what you do every day at work, showing up, working hard, being willing to learn, being a team player, improving in your technical skills. All of those things are attributes that the faculty in your residency program are looking at, and those are the things that they're going to say, when they call their friends. I have this great resident, and they do all these things super well. They'll be a great fellow for you. And so as you go through residency and you demonstrate those skills, the faculty will kind of speak up for you on that behalf. So that's something you can definitely do in residency to help kind of build your reputation as a strong resident, potentially strong fellow with the folks you're working with at your institution.
Gotcha. So kind of just building rapport throughout residency. Strong.
Yeah.
Okay. That's good advice. Thank you.
So you also had mentioned in your bio that you were a clinical instructor. And so I think that provides a different view to what you think makes a student a good candidate as for general surgery, or what they can do in the clinic outside of the typical, hardworking, networking. What do you feel is a special attribute, I guess? Hard question. Sorry, that's a very loaded question. Very loaded question.
It is a little bit. And I mean, clinical instructor is kind of a title that a lot of academic institutions use as kind of like a bridging title between fellow and kind of junior faculty. So for me, that means there's a couple of things I can do independently and specifically for transplant, that's being the donor surgeon. But for students and residents, I think, you know, like I already said, showing up, willing to learn, being a team player. You don't have to be the smartest person in the room. You don't have to be the most technically skilled, but if you're willing to learn and sometimes just like being available, being around instead of going off as soon as you can, shows that you're interested and will kind of allow you to build rapport just through, like, even if it's just hanging out in the workroom, for an extra 30 minutes or an extra hour. Not that you want to cross the line into like being at the hospital all the time, but just giving yourself more opportunities to really build rapport. So those are all other things that are kind of I don't know if nobody really says, but things that we don't talk about as much because they're those kind of intangible things, as opposed to like test scores and how many papers you publish and those sorts of things.
Right.
And I think we have one more follow-up question about that. Like, what did you personally do? Because you kind of said you kind of had a long journey deciding you even wanted to go into surgery. You finally made that decision. Do you remember some things you did besides like staying a little bit later to help form relationships that just helped you like stand out and be a good applicant for general surgery?
Yeah, definitely. So in medical school, I took opportunities to get involved in some extracurriculars. One of the specific things I did was we had a student-run clinic, and I was pretty highly involved. I was involved in that with not only staffing the clinic as a medical student, but also in the organizational aspect of running the clinic. So that was one thing that demonstrated some leadership. The other thing was getting involved in interest groups. I specifically was part of the ultrasound interest group, which I found very helpful, especially as a surgeon. It was kind of many medical students who wanted to go into emergency medicine because they use the ultrasound so frequently, but a couple of folks who wanted to do surgery. And I found that that was an opportunity for me to really practice some skills and also, continue those relationships with some other faculty who I otherwise wouldn't have really gotten to know very well. So look for leadership opportunities, look for learning opportunities, practice those technical skills, and all those things start to add up on your CV when you're applying to residencies.
That's good advice. Also, I love ultrasound as well. I really want to butterfly IQ things.
I know those.
Yeah, as soon as I start getting
nice.
my resident paycheck, I'm getting one.
And it's something that I at the time didn't quite realize how useful it was going to be. But what it did allow me to do was really start off strong in residency with solid foundation of how to use an ultrasound, for general surgery specifically, how to do a fast exam, just how to manipulate the ultrasound to get better pictures. And even now, still use ultrasound today in the operating room to do intraoperative liver ultrasound. So it's still something I use in my practice now. So anything that's like learning new skills, practicing technical skills, leadership opportunities, all good things to look into while you're still a student.
Awesome.
You mentioned liver quite a lot. Is that one of your favorite, I guess, procedures, or do you have another different procedure that's your favorite?
Oh, I go back and forth between loving liver more and loving kidney more. So it's really hard because so for abdominal transplant, which is what I'm doing, it's liver transplant, kidney transplant, pancreas transplant.
Okay.
Intestinal transplant is an option at some other institutions, not here at Vanderbilt, where I'm currently training. But I just go back and forth between the two. Love them both.
Well, what makes
it's hard
them
to pick
your favorite,
a favorite,
I guess. Yeah. Why do you enjoy it, I guess, then? We can do that.
So I really like the complexity. It's kind of a little bit of everything. It's a little bit of abdominal surgery. It's a little bit of vascular surgery. when you're sewing in either the liver or the kidney, you reperfuse the organ, and it, ideally it pinks up right away. And so you have that like immediate satisfaction. And then when the liver's doing well and it's making bile in front of you, or the kidney's making pee in front of you, you're like, oh, this is really cool. Like this organ is already working. And it's just awesome. It's a great feeling. So I like it for that reason.
That's pretty cool, actually. So then, so I feel like, especially with organ transplant, there goes a lot of ethics into it and a lot of politics that can happen. Do you say, is that one of the harder parts of being a transplant surgeon?
I think it can be, especially with, as we're trying to address the organ shortage, and we're trying to not necessarily push the envelope, but try to improve strategies for organ procurement and organ harvest. That can be a little bit tricky.
Yeah.
So yeah, but that's a whole nother interesting aspect of transplant surgery as well, is how do we address those things while still respecting the donor, putting everything into trying to save the donor's life. And then when they've crossed that threshold from trying to get better or really they're just a patient at that point, trying to get that patient better, and then you cross the line into this is now kind of medically futile. How do we respectfully make that transition, and but try to do everything we can to use organs for potential recipients as well. It can be kind of complex, and also interesting.
I think we had a question that was submitted in the chat.
Oh, great.
Yeah, so we had a question that asked, have you ever seen a dual transplant, like liver and pancreas simultaneously? And if so, how common are those?
I've definitely seen multiple dual transplants. I don't think I've seen liver pancreas. Some of the more common ones are kidney pancreas at the same time, and liver kidney, and then occasionally combination with thoracic transplants. So liver heart or lung liver. I'd say probably for us, liver kidney is probably the most common. Still not super common. I'd have to look at our numbers to see exactly how many of those we do. I'd say a super rough estimate, like 5% or less. I don't know.
Yeah.
Wow.
So we definitely see them. They're much less common than single organ transplant, but we do them not infrequently.
Yeah.
And I guess you just brought up a good point I hadn't thought about. Like, is thoracic transplant a totally different fellowship, or like how does that work?
It's a different pathway. So you have to do kind of the CT surgery pathway first, which you either do an integrated residency, which is general surgery and CT combined, or you do a traditional general surgery residency, and then you do a CT fellowship. And then I believe it's another fellowship on top of that. But don't quote me on that, because I operate from like the diaphragm down pretty much all the time.
The body stops.
Yeah. It's just this black box that's like right here.
Yeah. No, we understand. But would you say generally, like the common path, is there any other path outside going general surgery to transplant, or is there a direct path to transplant surgery?
Currently there's no direct path to transplant surgery that I know of.
Yeah.
Most common, it's general surgery to transplant surgery. If you're interested specifically in kidney transplant alone, I believe there is a urology to kidney transplant pathway that's a little bit less common as far as I know.
Right.
But I'd say the most common is general surgery to transplant surgery fellowship.
Okay. I was just curious, because sometimes like some people have to
it's
rent
kind of
into it. Yeah.
Yeah.
But I mean, otherwise, our last question listeners, if you have any tips for first-year interns starting general surgery, or especially when they have harder moments, because we know that residency is not always the easiest. So if you have anything for that, we'd love to hear it.
Yeah, I think so many. Let's see. Did I write some notes? I might have. Yeah. Okay. So, you're practicing. We're all practicing still. So you're going to make mistakes. It's going to be okay. That's why you've got a whole group of people kind of around you. So, learn from those mistakes. You'll get better every day. And then there's pretty much, I think everyone I know, myself included, has had a hard point in residency. Medical school and or residency, and it hits people at different times just based on what's going on. So don't be afraid to ask for help. Don't be afraid to talk to your friends about it. I think a lot of us like to really put on a brave face and, pretend like we're not struggling at all. But I think everybody I've talked to about struggling during residency has struggled at some point. So your mentors are around to help you. Your co-residents are a great resource. Lean on those people, rely on those people, and don't be afraid. Don't be afraid to ask for help. And then other than that, keep showing up, be willing to learn. Some of the best feedback has been that I'm teachable, and all really that means is that you listen and then you implement the feedback. Right. Even if it's not super obvious, or even if someone's not, a lot of times the feedback isn't like, I'm going to give you feedback right now. It's kind of little things throughout the day. Oh, do this in your next presentation. Oh, next time throw the stitch a little bit like this. And all of that is feedback for you to take and use to improve. So don't take it as you're like a bad resident or you're a bad person. If you're getting a lot of feedback, everyone's just trying to help you improve. And a lot of times we're not super good in surgery about getting a lot of positive feedback. That doesn't mean you're not doing a good job, but you'll find it's a lot of negative feedback or lots of room for improvement. But again, it's all just in the name of trying to make you the best surgeon you can be. So just roll with the punches a little bit. You'll be okay.
No, we appreciate that. Sometimes it's hard, especially being medical students and not knowing everything. So, but otherwise, that was our last question. Sarah, did you see any other questions in the chat that I might have missed?
No, I think that was the only one we got today. Dr. Kraft, is there anything else you want to talk about? Any last advice you want to give, or anything we missed?
I don't know. Consider Transplant. It's great. It's awesome. Super fun. Take opportunities as they come. That's all. I don't know.
Yeah.
Be willing to learn.
You gave us great.
Ask for help. And lean on your people.
All right.
I love it.
All right. Thank you, Dr. Kraft, so much for your time.
Yeah.
We know your time is precious. We appreciate all of your advice and hearing about your journey to transplant. And thank you to everybody who joined us for this Instagram Live. Once again, just to recap, this is our monthly Instagram Live series for surgical subspecialties. We host a new subspecialty every month, the first Monday of the month. Next month will be bariatric surgery. So if you're a bariatric surgeon or know someone who would love to share their journey, send us a message, because we'd love to have you and hear your story.
Thank you so much for having me. It's been great.
Yeah. No, thank you so much for your time. We appreciate you.
Bye. Have a good night.
Bye. See you, Amber.
See you, dude.